I would love to see you get. I love good news.
He just lost a tooth yesterday.
That's awesome. And you know, I don't like to take out teeth. I like them to come out when they're supposed to come out, when they're ready. So, did you take it out yourself?
Yep, I did.
Good.
And this one is gonna come out a few days.
Yes. So, with this next appliance that we're gonna give you today, the first one, the habit corrector, that's the one that you've been using for about 4 weeks. How have you done with that?
Let's be honest here. You want to show them your, this is Josh's. Yeah.
Let's take a look.
Joshua has not conquered the evening. He's half or a couple of hours. It's in his bed when he wakes up.
So do you have trouble breathing or swallowing when you have it in?
No, I could. It might be the. Well, this is something. Well,
was it your tooth that was bothering you? Because we know for about 2 weeks
that isn't. So.
And I always forget to. I sometimes forget to put it on.
Yeah, well, that's so. If you forget, we can't. We're not going to say anything about you.
He was chewing on it a little bit too, right to this tooth.
But if you have a tooth that's coming out and it's getting sore, then that would be a time to kind of take a break from it.
Okay.
And so the good thing about with his age, he's got several permanent teeth, and he's still got some primary teeth to lose.
Okay.
As the primary teeth come in, then this guide will basically guide them into place.
Okay.
And the teeth that are already in, they're out of alignment. The guide helps to align those also.
Okay, great.
And it's the habit corrector, though, still helps kind of train the muscles and the tongue and the swallow.
Yeah, which we still need.
So I still want to do the habit corrector, and I want him to do the habit corrector just at night for right now.
Okay.
And then do the occlusal guide, and yours has your name on it.
Yeah, we may have gotten those mixed up a couple times,
well,
so it's okay. Yeah. All right.
Yeah. So his is going to be a good bit bigger than hers.
Okay. Okay.
This is what it looks like, and it's still in the wrapper.
Wow, Josh.
So you can take that out for me, and I want you to look at it and tell me, just by looking at it, can you tell which are the top teeth and which are the bottom teeth?
This is the top teeth. This is the bottom.
How did you figure that out?
I just.
Because that was absolutely correct.
I predict the future.
Well, so you see that little bump right in the middle?
This?
Yep. That's the easiest way to tell what's top or bottom.
Actually, wait, I actually figured that out with this.
That's what it looked like you looked at that. So whenever you're putting that in, what some people find works well. I'm not gonna put this in my mouth, but it's still in the bag. But if you put your finger right in that little heart-shaped part, and then when you put it in, use your finger to kind of guide it right to the center of your two front teeth. So when you're putting it in, you kind of hold it like this, and then you try to touch between your two front teeth. And I'm going to put some gloves on to show you what I'm talking about.
Oh, by the way, since I lost a tooth, I think all that will fit in this side is nothing.
Yep. But the tooth that's going to come in is going to go into that spot.
Oh.
Yeah. So
get straight.
All right, so open wide. So I'm gonna have to put my finger right here, and then see how you I'm touching your gum right there. All right, now close your teeth together and just kind of hold that in place for me. All right, you see how that little divot lines up right with the middle of his gum? That's exactly what we want. So when this is in your mouth, I want you to keep your teeth inside it, okay?
Ow. Does it hurt?
It doesn't?
No, does it hurt?
Oh, no.
Just gotta tell the teeth where to grow.
So if it's making your teeth hurt, then you might be.
This tastes horrible.
Well, I haven't. That's so
Could someone please wash this?
I will. So let's rinse that off. And it may take a couple of days for that taste to.
We can put some thieves toothpaste on it later, okay?
All right, try that again. Let me see. I want you to. Let's see. Which hand, you use your right hand or your left hand for most things?
Both.
All right. Well, let's put your finger right there and your thumb right there, and then line it up and try to touch the middle. There. Now close your teeth together. That's perfect. All right.
Perfect, Josh.
So
Great job.
each tooth has a slot for it, and if it doesn't fit in the slot, then the guide kind of moves it to the slot.
Okay.
And helps expand his arch as he wears it. And as the permanent teeth come in, if he didn't have the guide, sometimes they would come in like too far towards the cheek,
Okay.
especially like the canines.
Ah.
So this helps catch him, and whenever it's in there, the pressure between the guide and the opposing in the teeth helps to kind of grow the arch.
Awesome. Awesome.
So what I want him to do is I want him to wear this for the next 4 months or next 4 weeks. I want him to wear it like an hour one part of the day and then an hour later.
Okay.
So for some people it's like, mid-afternoon and then evening.
Okay.
Will I ever
So,
get used to this?
look at Josh.
You will.
You're going to be able to get more Minecraft points.
Awesome.
Yeah.
So
By wearing it.
he doesn't need to, I don't want him doing any exercising with it right now.
Okay.
And a little, here's a chart for the guide also.
Okay. Okay. And then the teeth trainer at night.
Yep.
Okay.
So this talks about exercising,
Okay.
and when they're exercising, they have the appliance in their mouth and they squeeze for about a minute, and then they relax the pressure, but they keep their teeth in the appliance for about 30 seconds. So it's like squeeze, relax,
Okay.
squeeze, relax. So you squeeze twice as long as you're relaxing.
Oh, okay.
And you want to do it minimum of 20 minutes each session.
Okay.
And so eventually you'll need to be doing this like 2 hours a day.
Okay.
But right now I just want him to get used to it.
Okay.
And since he still has some loose teeth,
Okay.
if he were to squeeze too much, it would make him sore.
Okay. Hey, bud, your
So let's
teeth
see if we can
trainer.
put it back in.
Yeah.
Go ahead and put it back in. Let's,
You got it. You got it.
And I want to see if you can keep it in for 10 minutes, okay?
I
So-
will give you 4 Minecraft points.
So I'm
How
gonna
about
put
that?
this- I'm gonna put this in here, and anytime that is in his mouth, his lips need to be together.
That's what
And so
we're.
you can't talk with it in. That's the hard part.
And you can't take it out.
You can't take it out. And so you need to swallow. Try to keep your lips together.
You got it? High five. Can you do it? 10 minutes. Lips together. Great
All right,
job.
So
Let's.
I'm gonna put this case in here.
Okay.
Whenever, and I put that new chart for the occlusive guide.
Okay.
So habit corrector at night for him, and then 2 hours a day passively,
Okay.
just with his teeth in the appliance and his lips together. And he'll get used to it.
Okay. Great.
Here's
Hey.
your stuff, buddy.
What do you say?
So I want you to keep that in there. Yeah, he'll learn how to swallow with it. That's the trick.
Okay. All right. Let's put it in and I'll start the timer. Ready? And then you switch with Sarah, okay?
Okay. I need a whisk.
All right, so push this button.
Oh.
Yep.
Doesn't.
Okay.
That tastes like water now.
Yeah.
Okay.
All right, you want to switch seats with your sister?
Oh, sorry.
You want to switch seats with your sister?
Yeah. Yeah.
All right.
Okay, bud.
You might have come this way. There's not any room that way. Sorry.
Go this way, bud. Keep your mouth together.
Yep. Is the chair too high? I'm sorry.
Now we have the superstar right here. She, pretty much the day after, she was having hers in all night.
And for some people, it's easier than for others. And with I found the younger we start, the easier it is.
Ah, okay,
Because
okay.
Their jaws.
Joshy, don't take it out. Come on, just 10 minutes. You can do it. You can do it.
Just 10 minutes.
Their jaws are more pliable, and so the pressures on their teeth maybe don't feel as intense as
Yeah,
teeth that
there's
have been in there for a while.
and we've noticed her jaw's changed already.
Yeah, it's what happens is it's about 1 millimeter a month that you change that you can get.
Wow.
Yeah, and so it's essentially we're trying to recreate what the tongue would have done if it was strong enough
Okay.
and in the right position initially.
Okay.
So let me see. Smile real big. Open wide. Look it up. Bite down on your. So there will be a time where maybe her bite, she can't figure out exactly where it's wanting to go. Smile real big. All right, bite down. So right now I'm looking at like the overbite and the overjet, and within about 6 months, where you can barely see her gum down here,
Yeah.
you'll actually be able to see at least half of the bottom teeth,
Oh, wow.
and that'll show us that it's correcting.
Okay. Okay.
But yeah, that was a good swallow. I saw that. You've been practicing.
She
Did
has
you even
been.
notice it? And that's where it's going to help him the most is he's having trouble swallowing, and that it just takes practice. And some people it's quicker, some people it takes longer, but everybody does it at their own pace, their own rate. All right, so what do you feel? Do you feel like anything's been moving, like teeth or? Okay. How do you sleep with it in?
A little harder, but easier.
All right. So it was harder at first. Is it easier? Do you feel like you sleep better when you're wearing it or if you don't wear it?
I don't think she's not worn it, right?
Yeah.
It feels the same.
So if you're wearing it on a regular basis and it's staying in, then for the most part, that means that her body would have to do it well and it's opening up her airway.
Okay.
And so it's to me I call it the pacifier effect.
Okay.
And,
You know, I would say she's had less sinus stuff.
yeah, and it makes you breathe through your nose,
Mm-hmm.
and so that creates a negative pressure in your sinuses, which
I
helps.
already breathed through my nose.
Yep. But it helps basically, it helps the air flow through the sinuses better, so they're not stagnant.
Mm-hmm. And congested, honey.
Yep. So this is yours. Hers is a 4.5. His is a 6. That just has
Okay.
to do with the sizes. So hers is a little bit smaller.
Okay.
All right, here's your guide. You want to grab that for me? Do you want to go ahead and rinse it off? Because your brother said it tasted weird. You can. So push that button right there. And this room's waterproof, so don't. So she'll have a chart for hers as well. And
Okay.
she will.
Okay. 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 Done.
It'll be easy because I'm going to have her doing the same thing that he's doing.
Oh, okay.
Just wearing it passively for the next 4 weeks.
Okay.
But so they can do it at the same time. If,
Okay.
Yeah.
We'll pick some games or something to do.
all right. So can you tell what's the top and what's the bottom?
This is the top.
All right. So do you remember how I showed your brother how to put it in? All right. See if you can put it in like that. Perfect. Now smile real big. Let me lift your lip up a little bit higher. Now kind of squeeze your teeth together. Now just kind of hold your teeth together and put your lips together. Let's see if you can breathe okay. But if you look from profile, you can tell that it's pulling her jaw out. The bottom jaw.
Oh, yeah.
And that pulls her tongue forward, which helps open up the airway.
Very cool.
But with her, with
Oh,
proper,
it does take over.
yeah, with proper tongue position,
Close them up.
every time somebody swallows, it actually helps expand the upper arch, forward and laterally.
Ah.
Well, there has to be enough room for your tongue to get up there.
Yeah.
So once we make enough room, then and it fits in there easily, then the tongue kind of just takes over at that point. And that's where we definitely don't need the habit corrector as much anymore.
Okay.
But we can still use this, and essentially this will act like a retainer after a certain time.
Oh,
So
okay.
they'll wear it a good bit for like the first 6 to 9 months,
Okay.
and then we'll get to a stage where they only need to wear it so many hours a week.
Okay.
And then as teeth come out and new ones come in, they may have to wear it a little bit more to catch
Okay.
them. All right.
Awesome. So she's gonna be wearing this the same,
Yep.
which is
2 hours a day passively.
okay.
And so I recommend breaking it up into like 1 hour sessions.
Okay.
And anytime it's in their mouth, lips are together,
Okay.
and see how she has nice kind of relaxed cheeks.
Mm-hmm.
She's having to kind of force her bottom lip together. That's fine. It is kind of bulky, but she's able to swallow without having to use too much of her facial muscles.
Great
It's a mouthful.
job.
Yep. So y'all just need to practice, okay? So
Okay.
my goal for him is to be able to wear it 10 minutes straight without having to take it out or readjust it and
Okay.
still be able to swallow.
Okay.
So
That's and then we work up 10
Yeah.
minutes, 15 minutes. Okay.
but if he can do it for 10 minutes, then he can do it for an hour.
Okay.
Yeah, but once he's got to get kind of past that idea of thinking that he's drowning.
Okay. Okay. Oh, that's good. That's good. Okay.
And having anything new in the mouth will make the mouth produce more saliva initially.
Okay.
So because it thinks it's food. So after a
Ah.
while, they get used to it, and they won't be producing as much saliva.
Okay.
But right now, it's like excess saliva. And so
Okay.
there's a trick when you're swallowing to kind of get the saliva just pulled up too much. And what you do is you kind of open your lips and you kind of suck some of the saliva out of the appliance, and then you put your lips together and swallow. So it's like,
I think you were doing that
Yep.
with his teeth trainer.
so you kind of pull the saliva out, but then when you swallow, you need your lips together.
Okay. That
But-
makes sense.
As the saliva starts to diminish, then they won't need to do that anymore.
Okay. Okay. And then both of them habit trainers at night.
Yeah.
Okay. Okay, we can do this, guys. We got lots of practice.
Alright, so you can put it back in here for right now. And when it's not in your mouth, it needs to be in the case, okay? So y'all may want to go home and like use your toothpaste to
Clean it, yeah.
flavor it. But
It's just that new taste.
Yeah. But
Can I have a sip of water?
here's that.
Yes.
Was that your brother's cup?
I don't think he drank out of it though.
Nobody's used that.
No.
You want that cup? So I'm proud of both of them, and
Good job, you
Yeah.
guys.
the best thing about having siblings do it is kind of the modeling. You know, they're both doing it, and so it's kind of easier if one's doing it for the other to do it.
Yes, absolutely.
And so I do like to try to keep them on as close a schedule as possible
Okay.
for that reason.
Okay. Great. Great. Thank you so much, Doc. Anything else?
No.
Okay.